name is Mark Poolman. I am assistant athletic trainer here at the University of North Dakota. I teach in the program, and I also work with the men's hockey team. So majority of the information I have is very specified to hockey. However, injuries are injuries. So. For what I use it for, mainly AC separations or maybe some subluxations of the shoulder, groin injuries, high ankle sprains, MCLs, those type of injuries that I often see here. The buoyancy of the water, just the compression of the water. I keep the temperature of the water for rehab in the low 90s, so it's fairly warm. There again, depending on the injury, but from what I've seen, the benefit of using the water rather than the normal dry land or the normal rehab using the weight room or TheraBand, stuff like that, it's just the range of motion that you're able to get, I think improves the total rehab package quicker. Everything becomes much quicker, and again, that's what I try to do, and why we're here is trying to get the athletes back as quickly and safely as possible. The groin injury, it happened September 27th. It was a minor one. He's had previous injuries off and on. The previous year he had 2 of them to where they weren't severe. There was really no discoloration or swelling or anything, but it nagging enough to where we wrapped him for a couple weeks, and then he got over it and was doing better. But this instance, he hurt it on September 27th. It was kind of a mild strain, and then we were wrapping him and doing a few things, but it wasn't quite bad enough to where we used the pool, which my judgment probably wasn't right. We probably should have. He played in the game on October 6th, and he felt the pop, and he couldn't continue anymore. It was bad enough to where he couldn't open up his hips. He couldn't stride out well enough. So on the 6th, which was a Friday, he hurt it, could not continue. The next morning we got him in the tub, and we went through the full gamut of rehab that we would do for that type of injury, both with HydroWorx and all the other things that we would do. And then he was able to play the next Friday with the use. There again, we use HydroWorx, the Kaiser, different anti-inflammatory type of medication, all the different modalities, ultrasound, sound stem, IFC and ice, iontophoresis. But I do have pictures of him as well, to where it shows the bruising all the way down to the knee that he had when he was playing. So the bruising didn't come out for 4 or 5 days. The next day, the next morning. There again, just working on the range of motion, keeping the inflammation down, compression, ice, you know, all the basic things you do for an acute type of injury, but just to get the range of motion as well, to get the muscles moving, keep the swelling out and everything. So. The protocol basically starts up with a warm-up. For rehab, I keep it, you know, lower 90s, and the warm-up just walking, jogging, whatever they're able to do pain-free. And then I introduce maybe a little bit of flexion extension of the hip, of the knee, depending on what joint I'm dealing with. Flexion extension of the hip with internal and external rotation of the leg. There again, more so for the hips, the groins or the hip flexor. Start doing adduction, abduction just off the side. Doing a lateral slide on the treadmill. There again, just warming up the ad and abductors. And I try to focus on keeping their lower abs tight, keeping that athletic type of position. So they're down squatting a little bit, but there again, it depends on the injury, what I'm dealing with. Introduce a shuffle. There again, all these are kind of progressive depending on how they're doing. No matter what I'm dealing with, if it's the high ankle, knee, groin, shoulder, all the range of motion that they're doing in there should be pain-free. First we work on the range of motion, and then start working on the resistance. So that's I make sure they understand that first before they get going. So we do shuffle, and we start doing some crossovers. There again, just to warm up a little bit more not high impact, but a little bit more proprioception, a little bit tougher on the body, depending on the injury, obviously. Do some karaoke as far as the crossovers, more of a football move, but still you're using the hip muscles and warming it up. And then I get a little bit more specific depending on the injury, but the facing forward type of activity, looking like a hockey stride. So you're facing forward to get a hip extension, and then I want the hip to externally rotate. There again, more so for hockey, but there again it can be used for any sport, because if you're cutting in basketball and you're opening up and going on a 45-degree angle, that's what you're doing as well. And then I get really specific and get in the hockey stride, where they get in their athletic position, wide stance, bring the foot all the way in, and go to that 45-degree angle, basically externally rotate as you're going back. The majority of the injuries that we get with the groin or the hip flexors when the leg is all the way externally rotated and abducted, and then just as they start bringing it back. So that's the one benefit to the treadmill, is it allows that full range and then some resistance to come back through the water and through the jets. So.